I have paperwork on protocolkills.com that you can specify how you want your current health care done while you're alive and able to make decisions. And then how you want your health care after that. Maybe there's certain things that you want to change or specify that, you can assure yourself to the best of your ability that you're doing the right thing and helping somebody, but also protecting yourself. Because what we found out is a lot of people aren't being protected. So I'd like to go in first with your story and how you became involved in all of this.
Sure. Back in the late 1980s, I was a resident studying how to become an anesthesiologist in a training program. And I came in for night call one night and reported for duty. And they said, "Oh, Klessig, glad you're here. We'd like you to go up to ICU. There's a brain dead man up there. We'd like you to bring him down for organ harvesting." And I sort of gulped because, I sort of remembered hearing about brain death somewhere along the line, but I did not have all the facts at my fingertips. So I asked him, I said, "Brain death, huh? Is there anything different about this case that I need to know?" And the man just sort of rolled his eyes and laughed. He said, "Just be sure someone has actually declared him brain dead. You know how eager the transplant team can be." Well, but that wasn't what I wanted to hear, right?
Yeah, that's a red flag right there. Like, that alarms would have been going off.
So I found that very confusing, but I went up to investigate further. I found my patient up in the ICU. He was a young man about my own age at the time, and he had been in a motorcycle accident and had a very severe traumatic head injury. And yes, the neurologist had indeed declared that he was brain dead. So I went to look at my patient, and funny thing, when I went in the room, he sure didn't look dead. He was lying in his bed. He was warm. He was pink. He was, breathing with the help of a ventilator, like so many ICU patients. He had normal blood pressure, normal heart rate. He had nearly 100% oxygen saturation in his blood. I mean, he looked like every other ICU patient I'd taken care of, and in fact, better than most. Mm-hmm. So I took these facts back down to the operating room, and I found the staff anesthesiologist who was going to be supervising me for the case. And I presented the facts to him, and he said, "All right, what's your anesthetic plan of care?" And at that point I was, sort of brainwashed myself, I guess. I was being trained to think a certain way. So I said, "Well, I'm going to give him a paralyzing agent so he doesn't move during the surgery and upset the surgeons. And I think I'll give him some fentanyl, which is a potent painkiller, so that he doesn't have swings in his heart rate or blood pressure that might damage the organs." So then my staff anesthesiologist looked at me and said, "Are you going to use a drug to block consciousness?" Well, I was sort of stunned. I asked him, I said, why would I do that? Isn't he dead?" And he just gave me this long look over his surgical mask, and he said, "Why don't you give a consciousness blocking drug just in case?" And he walked away.
Just in case.
It is to my regret. I am so sorry looking back at it, because it didn't make sense, right? It doesn't add up. Why should a dead person need anesthesia at all? Why should we have to worry about them possibly being conscious and having to give consciousness blocking drugs just in case? But, to my shame and regret, everyone else was going along with it. So I did too. I did what I was told. And I brought the young man down to the operating room, and I gave him the anesthetic we had discussed. And I'm here to tell you, he reacted to the incisions, to the bone saws, to the organ removal, just like anyone else. He required the same types and amounts of anesthesia as anybody else. And so, looking back on it, I can tell you, honestly, that man was in no way dead. I told this story to a friend who is a pathologist, and she said, "Heidi, when I take out organs in the morgue during an autopsy, I don't have to give any drugs at all." So really, it's my regret over this incident that motivates me to be speaking about this with you here today, and motivated me to dig in further and to try to find out, where does this idea come from?